Hi, welcome back to Heal and Learn. My name is Dr. McKellen Drayen, and I'm here in Phoenix teaching acupuncture students about applied channel theory right now. I want to just keep continuing on about the greater picture of all the organ systems in applied channel theory. So today we're talking about the channel system of Shao Yang. So Shao Yang in our little zigzag is going to be the last organ system. And so we are going to be talking about the gallbladder and the jiao. So the Shao Yang is known for being replete but not filled. Replete by definition means full or abundantly provided. So it's jiao and gallbladder saying it's replete but not filled. So there is substance to the Shao Yang meridians. Okay, so the primary metabolism of Shao Yang is going to be movement and regulation outside of the organs, and then this is going to be our decision maker. With the Shao Yang, this is providing the pivot between the yang regions. So Tai Yang was the skin, the external regions. That's why it's covering the back. That's why we have wind cold, wind heat, specifically wind cold coming in through the Tai Yang. And then the Yang Ming is going to be the pathway of digestion. So the Shao Yang is in between these two. The Shao Yang is associated with movement and regulation in the areas outside of the internal organs and applies to all the yang areas of the body. So we know that Sanjiao 5 is the opening or the command point of the yang wei, and the yang wei is just the external part of, or the lateral part of your body. And then this is also saying that the Sanjiao is the area exterior to the internal organs. So we could start to think about this as fascia. So the fascia is not the organ of any of this, but yet it's like this connective system connecting everyone through decision making, potentially, through deciphering where and how to do it, which is a decision. And so all of a sudden, all these small movements are being applied to these tissues, and then these tissues communicate through the whole system. The gallbladder is going to be within the joints, and we know that gallbladder 34 is the command point of the joints and the sinews. Why we would use Shao Yang is to drain in cases of excess and accumulation, and then when there's compromised functions leading to clumping in the interior. So this would be our dampness. So we're draining, and what do we drain? We drain dampness. So this is all about this dampness leading to stagnation. So the Shao Yang system is a source of qi. It's diffusing and it's diffuse and vital components which warm the organs by stimulating functions. If we're stimulating functions, we have a decision that needs to be made by the connective tissues of the fascia that needs an action to be done. Does that make sense? So our fascia throughout our whole body, because this is saying that the Shao Yang is not within the organ, but on the outside of the organ and on the outer side of our body. So that is where fascia is. Fascia is also on the inside, but just with this definition is all on the outside of the body. And what is happening is it's stimulating a function because our fascia senses that something needs to change. And so then the decision is made to make a change of a function. Okay, I think that makes sense. So Shao Yang is balanced in the center and spotless. This is a physiological role of being the decision maker. So again, Sanjiao of the Shao Yang is going to be distribution of source qi. This is going to be our endocrine system and our systemic components. It's going to be regulating the climates surrounding the internal organs and other structures of the body. So with this definition, I'm introducing fascia, and fascia would be found everywhere, and so that could also regulate any of the climates of any part of our body. But there's another Western term that also would function with all this. It would be our lymphatic system. So with the lymphatic system is going to make sure that the organs are functioning properly. It's going to make sure that the organs can breathe. It's going to be making sure that the body is releasing and getting rid of toxins. It's making sure that the body can put all the toxins in one area to help clear it all out. The most prominent, we have our lymph nodes and we have our thymus, which is over our heart. And if you look at where the jiao meridian flows through, it crosses the thyroid and the lymphatic and then goes into the heart. So this could really be our endocrine system, such as our thyroid. It could be our endocrine system, such as our lymphatic. It could be our fascia that's able to create these decisions full body. Lymphatic system's working full body. Lymphatic is found on every vein, on every artery, on every joint. If you look at the diagram of the body of the veins and the arteries, the lymphatic system matches that exactly too, because the lymphatic system uses the veins and arteries to help create a pumping system. Remember, the lymphatic system is all being pumped towards the heart. And so we could do dry brushing or vibration plates, rebounding, even just pump, like calf pumping, jumping rope, exercising, anything is going to start to move all of this lymphatic system to get rid of it and expel it. So that was a lot to say about that. But then the gallbladder is going to be helping with absorption and digestion. Our gallbladder just feels so simple compared to the jiao, which most classes don't really talk about the jiao that much. But applied channel theory has a lot of different functions for it. I love this breakdown of the sinews versus the bones versus the muscles. So in this breakdown, we can see that foot joy yin nourishes the sinews, which is a yin function because we're nourishing and we are doing liver blood. If you look at liver 8, those are like the key things, is to make sure the sinews are being nourished, along with like menstruating. That's also a big part of liver 8. Then the foot Shao Yin is going to be nourishing and developing the bones through the marrow. That's going to be our kidney essence or kidney jing. And then we have foot Tai Yin nourishing the muscles. With all of this, you can start to see that foot joy yin could be a great meridian to be using if this is a muscle tear or if you have a ligament tear. Foot Shao Yin would be used if you have a bone issue, and then foot Tai Yin would be used if you have a pulled muscle. So, and then you could be working on Shao Yang if you have a movement issue. So I'm an athletic trainer as well. That's my background. If you think about why people have different injuries and different issues, then you can really start to break down which meridian and which acupuncture points you're needing to be using to help resolve that issue. The hand Shao Yang is the triple burner. It's the official functioning as the opener of the channels. Okay, so the Jiao is going to be responsible for providing a pathway of source qi, possibly through the fascia, possibly through the lymphatic system, possibly through the endocrine system of the thyroid. It also is managing all the different types of qi, so it's decision making of where to go and how to use it. And then it's also a location for meeting and transforming the yin and the yang. So since this is within the pivot and it's able to make all these different decisions, it can start to transform and make all the different functions of the organs working optimally. Jiao is such an underutilized meridian. I use Jiao every day on majority of my patients. Depends on what they're doing and why, but most of the time I'm using it. So again, just talking about this with the Jiao associated with the fluid-filled spaces surrounding the tissues of both the internal organs and the limbs. So this is the space inside the mesenteric lining and connective tissues. So this is going to be body fluid, but not blood. So I don't know if we don't just have blood flowing through every part of our body. We have capillaries filling these spaces, but ultimately what's going to be happening is it's in between the blood vessels and the organs. So all fluids within the jiao are sourced from and returned to blood, but they're not blood. And so this is again why it's so nice to think about it as fascia, because fascia is touching the blood vessels, it's touching the lymphatic vessels, it's touching the muscles, it's touching the organs. So it can be triggering and starting a bunch of different functions within all of this because the fascia and the connective tissue are all around, which the jiao is also in all three burners. So you can start to see like why and how it is capable of communicating so thoroughly. This is saying that it's providing a pathway for source qi present throughout the entire body, but does not have a distinct form. The functions and locations can be defined. The form is defined by the body structures. So this is like very loose, right? So it also helps with water and grain, such as nutrients, enzymes, hormones. So again, very endocrine system. Present in the fluid pathways and functions to nourish and transmit information about the internal environment. Involved with large systemic activities. Again, with different types of qi, this is really just going to be talking about whether it's hormonal, disease, dysfunctions in the body. This is all going to be needing rebalance, and the jiao can help rebalance. Okay, and then yin to yang transforming. This is really going to be the nutrition leaves the vessel and enters the jiao spaces, which is then taken up by the cell, facilitating metabolism. So yin to yang is going to be the nutrient substance to the function, or we have yang to yin, which would be the cellular waste metabolism is transferred and then removed. Here's some examples of why we could be using jiao that maybe you're not using it yet. All channels and network vessels are within the sphere of influence, and so we could be using this for obesity, we could use it for systemic inflammation, autoimmune disease, conditions involving multiple symptoms and channels. So this is why I can easily use it every day on the majority of my patients. Okay, the gallbladder is the official functioning as rectifier. Decisions and judgments originate in it. For the Shao Yang, the gallbladder, this is going to be storing and excreting bile. It's going to be the yang organ, which conducts substance through the digestive path, not situated in the path, and it's going to excrete less clean materials. So remember how we have, Ji and Yi? So our two different types of substances, that's all going to be the thicker substance. I forgot what that one is. We also then have the gallbladder have an extraordinary organ. So this is producing a substance which are clear bile, yang organ with clear essence, produces clear bile from substance transformed by the small intestine, which we talked about how the small intestine creates red, and that is going to be a thicker bile or thicker substance as well. And then the other huge part of the Shao Yang is going to be the decision making. So classically, all other organs are said to rely upon the gallbladder. Works with liver, Yin, to make clear decisions on a strategy. And then if there's a deficiency or disharmony, the liver Yin results in digestive disorders. So ultimately, this needs to be balanced. And I think one of the last responsibilities is controlling the sinews. So remember, the nourishment of the sinews will be the liver blood, versus the gallbladder Shao Yang will result in the movements. And that is that. Super easy. Okay, if you have any questions, comment. I'll be looking. Otherwise, stay tuned and I'm going to do a little breakdown of how to connect Jui Yin and Shao Yang together, along with, probably not today, but soon, I'm going to start showing you guys mixing and matching of how to be doing other tresses, and you can really start treating everyone and anyone with these tresses. So I hope you keep following along, and I will see you soon.